Hi, I'm Katy Davenport. I'm the lead nurse for diabetes at Addenbrooke's Hospital. Today the topic is delivery and postnatal period. The learning objectives for today are what to take to hospital, how to manage diabetes during and after delivery, and what to do with breastfeeding. Preparing for delivery. From 32 weeks, start to discuss plans for delivery and how to manage glucose levels during this time. Between 34 and 36 weeks, a plan should be written for insulin dose or pump settings for delivery and after. Think about now what a birth partner could do to support during delivery. What to pack. Here's a checklist showing you what you need to take to hospital. Don't forget hypo treatment, either glucojuice or glucose tablets, and healthy snacks in your bag. Preparing for delivery. It's really important to place your insulin pump and sensor somewhere where it won't get in the way. We recommend under the rib cage and towards the back. Remember that some midwives may not have seen pumps or sensors before, and they may need to check glucose measurements for their records on hospital meters. Think about now about your postnatal targets as well. These will change. You're about to deliver the baby. Remember to keep using the glucose sensor and monitor your glucose levels hourly. The targets for delivery are between 4 and 7 millimoles. If a glucose level is out of target, check with a finger stick. Generally, we expect your blood sugars to stay between 4 and 7. If they're low or high, you may ask for an insulin drip to help during this time, and the midwife will support you. Remember to keep going with healthy snacks to avoid getting starvation ketones. For a caesarean section, a pump can be used, and remember where that pump is placed. It can be removed if necessary for up to 60 minutes, but please remember to reconnect immediately after. That could be a job for a birth partner to remember. Pump users also have the option to change their settings beforehand. After delivery. So your baby's arrived. Now remember that your insulin requirements will drop immediately. Change your pump settings as soon as possible. We recommend that your background insulin is going to drop by about 50%. The insulin to carb ratios will be 1 unit to 12 to 15 grams of carbohydrate. The correction factor will lower by 3.5 to 4 millimoles for every 1 unit of insulin. And your targets will change. These will be 6 to 10 millimoles for the first few days, and then later moving to 3.9 to 10 millimoles. The final thing is, don't forget, no insulin with the first meal after delivery. So after delivery, change your sensor settings. If you're wearing a Libra, change this to 3.9 to 10 millimoles. For any other sensors, look at the glucose threshold alert, and this can be set between 4 and 5 millimoles. May also be helpful, especially if you're breastfeeding. The urgent low soon alert will alert 20 minutes before glucose reaches 3.1 millimoles. This gives you time to treat for a hypo if needed. It's a good idea to keep the high alerts on, just to help you manage if your blood sugars go too high. And don't forget, after delivery, you're at risk of hypos, so it must be 5 to drive, and always keep your hypo treatment within reach. If you're breastfeeding, look at your sensor information or scan the Libra before and after each feed or express. Aim for a glucose of at least 6 millimoles before feeding. To avoid hypos when you're breastfeeding, use the directional arrows on your sensor or Libra. If one arrow is pointing down, use 1 jelly baby or 4 to 5 grams of carbohydrate. If 2 arrows are pointing down, go for 2 jelly babies or 8 to 10 grams of carbohydrate. Generally, when you're breastfeeding, we would recommend 10 to 15 grams of carbohydrate. You can use a temporary basal rate, but mostly we find that a bit too slow, so maybe just for cluster feeding. Remember, always have your hypo treatment and carbohydrate snacks to hand. Another thing to remember is that you want to change when you have your insulin boluses just before eating. Instead of having them 10 to 15 minutes before food, aim to have that bolus just before you eat. This helps avoid hypos. When you're going home, continue to use your glucose sensor to adjust being at home with the baby. Be prepared that your insulin doses are likely to need changing after the first few days or weeks after birth. The diabetes team will always be happy if you want to contact them for dose adjustment advice. A diabetes postnatal follow-up should be made for 6 to 8 weeks after the birth of your baby. So, I hope that you've found this useful. Thinking about what to take to hospital, what to expect for your glucose levels, how to manage your insulin doses and glucose levels during and after delivery, managing your glucose levels while you're breastfeeding, and what your birth partners might do to be able to support. Thanks.